Welcome to the Explainer. Today we're diving deep into a really targeted medication called Ambrisentan and the relentless disease it was specifically engineered to fight, pulmonary arterial hypertension. All right, so to really get how this drug works its magic, we first have to understand the very complex problem it's going up against inside the human body. So here's our game plan. We'll start by unpacking the PAP problem, then we'll see how Ambrisentan launches its very specific mission. After that, we'll cover the benefits of that mission, and then, and this is super important, we'll go through the critical warnings and side effects. Okay, so to really understand our hero, Ambrisentan, we first need to get to know the villain of this story, a condition called pulmonary arterial hypertension, or PAH for short. So picture this. The arteries going from your heart to your lungs are supposed to be like these nice flexible hoses. But with PAA, it's like those hoses start to get squeezed, thickened up, and really stiff. This creates a massive bottleneck, and it forces the right side of your heart to work dangerously hard just to push blood through. And wow, you can really see the difference here, can't you? On the left, that's a healthy, wide-open artery. But just look at the one on the right. The PAS artery is so obviously narrowed and scarred up. And this isn't some minor tweak, you guys. This is a huge, fundamental change to the blood vessel that puts an incredible strain on the whole system. And the main bad guy driving this whole dangerous process is a substance called endothelin-1. In people with PAH, their bodies just make way too much of it. It's basically screaming at the arteries 24/7 to clamp down and get thicker. So, if endothelin-1 is the problem, what's the solution? Well, it has to be a direct counterattack, right? And that's exactly where Ambrisentan's mission comes in. And boom, that's precisely what Ambrisentan is. It belongs to a class of drugs called endothelin receptor antagonists. Its entire job, its whole purpose, is to get right in the way of endothelin-1 and stop it from causing all that damage. Now here's the really clever part, its selectivity. Think of endothelin-1 as a key, and it can fit into two different locks on your blood vessels, ETA and ETB. The ETA lock is the one that triggers all the bad stuff, the constriction, the scarring. Ambrisentan is like a master locksmith. It's designed to very precisely block only that ETA lock, while leaving the other one more or less alone to do its other jobs. So let's break down how that mission actually works. First, Ambrisentan gets in there and physically blocks that ETA receptor. It basically slams the door shut. This means endothelin-1 can't dock and send out its harmful signals. And the result is a 1-2 punch. The arteries can finally relax and widen, which lowers blood pressure. And it also helps slow down that progressive, damaging scarring of the vessel walls. Okay, that all sounds great in theory, right? But what does this targeted blockade actually mean for a patient day to day? What are the real-world results? Well, for patients, the benefits can be a huge deal. It's approved for a specific type of PAH where the problem is right there in the lungs' arteries. And the studies show it helps improve their ability to exercise, something that's often measured by seeing how far they can walk in 6 minutes. But even more importantly, it helps to slow the disease down, delaying it from getting worse and taking some of that immense pressure off the heart. And the best part? The delivery is super straightforward. It's just an oral tablet, usually taken once a day. The typical dose to start with is 5 milligrams, but a doctor might bump it up to 10 if they need to. It's a really simple, consistent routine. Okay, let's pause here because this is probably the single most important part of this whole explainer. A drug this powerful comes with equally powerful warnings that you absolutely have to respect. So the FDA puts what's called a boxed warning on a drug when there's a significant risk of serious, even life-threatening side effects. And for Ambrisentan, it's something we absolutely have to pay close attention to. The drug is what's known as a teratogen. That's a scientific term that means it can cause severe, devastating birth defects if it's taken during pregnancy. And let me be crystal clear. This isn't a maybe or a potential risk. It's a known, definitive fact. Because of this, the drug is only available through a very strict, restricted safety program. And that program is called REMS. It stands for Risk Evaluation and Mitigation Strategy. It's basically a closed-loop system. The doctor, the patient, and the pharmacy all have to be officially enrolled. For any female patient who could become pregnant, this means mandatory monthly pregnancy tests and using 2 reliable forms of birth control. And I really want to stress this. These aren't just good ideas or suggestions. They are non-negotiable, absolute requirements to even get the prescription. And the safety net doesn't end there. Regular blood tests are also a must to keep an eye on liver function and hemoglobin levels, because ambrisentan can affect both. Doctors also have to watch very closely for any signs of fluid retention or edema, which is another potential side effect. All right, so moving on from those really critical safety rules, let's talk about the more common side effects and interactions that patients should know about. So, aside from the major warnings we just covered, the side effects that pop up most often are things like swelling, especially in the legs or ankles, that's peripheral edema, along with a stuffy nose, headache, and sometimes flushing of the skin. And this is also super important to know, drug interactions. For instance, if someone is taking a common transplant drug called cyclosporin, it can cause ambrisentan levels in the blood to shoot way up, so the dose has to be limited. On the flip side, things like the antibiotic rifampin or even an over-the-counter supplement like St. John's wort can actually make ambrisentan less effective. This quote right here really brings the whole story together. Ambrisentan is a highly targeted, really effective weapon in the fight against PAH, but that power demands a profound respect for its risks. The strict safety rules aren't there to be a hassle, they're there because they're what makes it possible to use this powerful medicine in the safest way possible.